our health, our wellness is as important as everything else that we do. And this morning, we have decided, as it's the month of October, we wanted to remind ourselves that one, we are aware that breast cancer is becoming one of the significant threats to wellness, especially women's health. And we want to bring awareness today. We want to do this in a conversation. I do have a panel of guests that I would allow them to introduce themselves to you. However, already I know that you saw the poster. We've got two incredible, very accomplished doctors that will speak to us. And also we have, I would say, our victory story from Mrs. Thuli. And she's going to be sharing her story and some of her experiences and overcoming, I wouldn't say battling, but overcoming breast cancer. So I want us to just take a moment at this time. I know that it's quite a sensitive topic that we're going to talk about. It's quite harsh. Cancer is quite harsh. So I want us to be present in this moment. I want us to not worry about what the day looks like, what is up next, what we have had to put down to be in this session, and not rush this session and not concern ourselves as well about whoever is meant to be here, perhaps who is not here. We're just going to be present. I want us to breathe. I want us to allow ourselves to be calm and to then let ourselves hear and learn what we are meant to learn. So I'm going to allow my guests to introduce themselves. I'm going to try and pin them here so that you meet them. I know that network in KZN is an issue. That's why I'm in the coffee shop. But should we get cut off for some reason, the meeting will go on. I've made the facilitators, I've made them co-hosts so that should I cut off or any of them get cut off, we will still be safe. So in this moment, can I allow you, Dr. Dineo, to please introduce yourself at this moment?
Good morning. Good morning. Thank you so much, Mabongi, for having us. Yeah, I think this is such an important topic. My name is Dineo Sefoloko-Chitambo. I'm a medical doctor, currently practicing as a general practitioner. I have special interest in holistic health coaching, wellness, weight loss, as well as child health. But I'm quite passionate about health education in general. Which is why I was spotted by Mabongi doing a health series on breast cancer awareness on my page, as much as I am just a general practitioner. So yeah, that's me in a nutshell. I'm currently practicing Mhlanga in Durban. Yeah, and my practice is called Wellness 365. Thank you so much.
Thank you so much. We're excited to have you, Dr. Dineo. I love the excitement you bring on social media. You're just making the sight of doctors more, enjoyable. Because I mean, each time you go to a doctor, it's because you're facing some challenges. And so when you're seeing a relaxed face, a smiling face, you're less intimidated. So thank you so much for your contribution there. I wanted to welcome as well Dr. Prudence Buthelezi. Please introduce yourself, Dr. Prue.
Okay. Good afternoon, morning, everyone. I'm Dr. Prudence Buthelezi, well known as Dr. Prue. I'm a GP with 20 years experience both in public and private sector. I'm an author of the book that is called Fortitude, which is all about people with disabilities and helping parents to cope when they are raising their children with special needs. I used to work for Vet Health Consortium at Oncology Department when they started the Oncology Department at Rockefeller Hospital. So breast cancer is one of the topics or one of the subjects that I love so much, and I love teaching the community and as a whole. Thanks.
Thank you so much, Dr. Prue. We just want to honor you. I know that you also not only just take care of patients, but you also take care of practitioners through Ukarabo, is it an association, yes, for health practitioners that includes both doctors and nurses and the staff that works in the medical field that are not necessarily doctors and nurses. So thank you so much for that. We do appreciate having you. And I know this was supposed to be a relaxed morning for you. So thank you so much for making the time. I want to also welcome Mrs. Thuli. Please introduce yourself to us, Mrs. Thuli. We're going to hear more from Mrs. Thuli as well as the session progresses. Yes, you are unmuted. You can go ahead. It's okay if your camera is not working.
Okay, morning, Sanbonan guys, morning everyone. This is Thuli Letsoalo from Gauteng, Pretoria, Soshanguve, and I'm a cancer survivor, and I'm working at the South African Reserve Bank in Pretoria. Thank you so much for inviting me.
Quite an honor to have you. Thank you so much for making the time. I think one of the things that we appreciate about having you is to then say, although the cancer itself as a disease is horrible, but we do have victors that we can talk about. And also not to make it light that people can survive cancer, so it's not as bad, but to just give courage to those perhaps who have experienced, hearing those diagnoses. So having you is such an added value to this conversation. So thank you so much. I am going to start our conversation off with you, Dr. Dineo. I wanted to maybe start this conversation by understanding what cancer is. Can we begin, maybe, Dr. Dineo, by just laying a foundation that perhaps we don't know? Many people have heard about breast cancer, including myself, but not everyone fully understands what it is. I know for myself that the only time I saw cancer was I was in a hospital in this ward after my surgery, and I wake up and the person not too far from my bed is a cancer patient. That traumatized me so much because I could see their battle. And so from my standpoint, it's not knowing what cancer is, but just knowing how horrible it is. So I want to know more about the details, the little details that we are meant to know about cancer as lay people.
Thanks so much, Mabongi. So I think when we define a cancer generally in medicine, it is the abnormal growth, rapid abnormal growth of abnormal cells in the body. And it can happen literally in almost any place of the body. So with breast cancer, it is the abnormal growth of these cells, particularly in the breast tissue. And these abnormal cells, of course, they can then invade nearby tissues. So they can invade the rest of the breast, and they can then spread, what we call metastasis in medical language, basically spreading to other parts of the body, where they then cause more of this abnormal growth of cells. And unfortunately, although we can have benign, which are non-harmful tumors or masses in the breast, a cancer is when it has then become deadly or malignant, as we call it. And it then begins to eat away at the healthy cells. It then begins to become a larger mass that's hardened and can become destructive to the nearby tissue and to other organs in the body. And slowly, these abnormal cells start eating away. Basically, if you can think about it in simple terms, is these abnormal cells start eating away slowly but surely at the normal parts and tissues of the body and the normal processes of the body. So the normal processes of the body start deteriorating. And so that's essentially what a cancer is. But what I really want to harp on is the fact that just the word cancer creates so much fear. When we hear cancer, it's like, oh, I'm dying, and it doesn't always equate to that. There's a lot of things that we need to assess once you have a lump, because that's the first thing we're going to pick up, that you have a lump in your breast. And it doesn't always equate to a cancer. It could be something that's not yet cancerous. It might become cancerous. Maybe it is cancerous, but it's still in a stage where we can either still remove it or it can still be treated. So it does not always equate to death. However, the reason why we are doing all of these talks, this awareness, is because most of them are picked up at a late stage, where they are now, unfortunately, at the point where they are deadly, they've spread to the rest of the parts of the body, they've destroyed a lot of the tissue around the breast, and it's quite late on where not much can be done and there aren't many options left. So yeah, that's what I can say.
So you've just touched on one of the myths that we already have about cancer, that actually if I have a cyst, that's equals to cancer. And I love what you're saying, that it could be detected early. What does that look like? What does early look like? If someone says this was detected early and this was detected late, what would be the difference between the two?
So early detection would look like just picking up changes in your breast tissue. And this is why it's so important to be aware of what our bodies look like on a daily basis. We should just be having a look at ourselves in the mirror to see what the normal structure of our chest, our breast tissue looks like. Early detection would look like noticing that maybe there's some skin changes around one of the breasts. Skin change, maybe there's a lump. So when you do self-examinations, you should be able to feel what's normal, and once there's something that's a bit abnormal, feeling maybe a lump, the lump that is hard, it's not mobile, so it's not moving, it's growing larger. There's maybe a nipple discharge, right? And there's at a later stage, there's what we call this skin change per orange, right? It's the orange peel appearance of the breast. But honestly, that happens at a very later stage, where the breast cancer has actually, or the tumor has now started invading even the skin, the superficial skin. So simple things in the beginning that you should note is there's a lump, and the lump, it's been there for some time now. Every week you check, it's still there. It's hard, right? It's a hard lump. It's not one of those lumps that you might feel maybe after a period or while you're breastfeeding if you've just given birth. It's growing. It's sometimes maybe painful. It's not always painful. It may be painful. There's a discharge, and there's just maybe the one breast is now lying a little higher or lower than the other, so small changes like that. And then we also say feeling for what we call lymph nodes. Angikwazi ukuthi yini konje ngesiZulu.
The gland.
The glands, yes. So feeling for the glands, particularly in the armpit, is also quite important. So those would be early signs, which we all need to be very aware of. And also the reason why we need to be doing self-examinations minimum once a month, but particularly after your period. And then late onset would be, finding a mass that's now it's been there for some time, because if you're not feeling your breasts a lot of the time, you wouldn't pick up unless it's now gotten to the point where it's actually starting to show towards the outside and cause that pure orange peel skin texture. It's now started to invade more tissues of the breast. It's actually metastasized or spread, in simple terms, to other parts of the body. It has now sort of reached what we call stage 3 or 4, where it can no longer be resected or removed by simple surgery. And so that would be what is called late onset or a late discovery. Yeah.
That is so clear. It feels like although cancer, breast cancer is harsh, but it does send many signals before it actually takes over. And that I think it does give a little bit of hope there. Thank you so much, Dr. Dineo. And I know that, with awareness, it's powerful if we act. It's powerful if we then become active once you pick up those signals or symptoms. Can I bring you into the conversation, Dr. Prue? What are some of the practical everyday steps that people can take, perhaps to, maybe let's start back, to reduce the risk, and then maybe moving forward to so that we actually detect this early. And perhaps you can take us further and say and maybe explain some of the practical steps of self-examination before I even get to the doctor for screening.
Okay, as the doctor said that you need to check yourself daily in the mirror. So you need to stand in the mirror and look at the size. The size is important of our breast. If the other one is now starting to be getting larger than the other, then get worried. Number 2, you should look at the nipple itself. You know your nipples, that they are pinpointing or they are retracted. Once it gets inside the skin now, then that means there's a problem. Then try to squeeze your nipple. When you squeeze your nipple, there shouldn't be any discharge. If there's anything that is coming out, stand up and go and look for help. Then you start now palpating your breast, putting one hand, if you are checking for the left breast, then you put your right hand behind your head, then you move it around your breast with your fingers and you feel any masses. So if there's anything that you can feel, because when we are going to have our periods, there's usually some little lumps that are there. So you need to know that, okay, towards my period, these are the normal lumps, and then they disappear. But now there's this lump that is there. It's almost 2 months that it's been there, and it's not disappearing. Get worried and go and look for help. So what is important, uthi idokotela kuba itimvilaphi lezi sizwayo entameni ngaphansi kwamakhafa, you'll feel itimvilaphi lapho. So if you feel those things, different things in your body, if you see any changes, in fact, just go and ask the doctor so that they can do further investigation. As we're saying that early detection, it means they can treat it, and then it can be also prolong your years of living. When we look at the risk factors, those we say is modifiable risk factors and non-modifiable. Non-modifiable is that there's nothing we can do, like we are female. So as a female, I am at highest risk of developing a breast cancer. Number 2, as we are aging, growing old, we cannot remain young. We are all growing old each and every year, so we can prevent it. So when we grow older, the more we grow older, it's associated with a higher risk of developing breast cancer. Then there's what we call the genetic mutation, BRCA1 and BRCA2. So if you have this one, just know that you have a high risk of developing breast cancer. And family history. If the family history, your mom, your aunt, your sisters, they had breast cancer or ovarian cancer, then you have a high risk of developing a breast cancer, including prostate cancer. If your father or your uncle, they had prostate cancer, make sure that you check yourself there and there, that aren't you developing cancer very soon. When we look at the modifiable one, is the lifestyle. Physical activity is important. Exercise, as it will reduce the risk of developing breast cancer. Consuming alcohol and smoking cigarettes, it puts us on the high risk of developing breast cancer. The food that we eat currently, which is highly saturated fats. Those foods that are highly saturated with fats, they make us to be highly exposed to the risk of developing breast cancer. So it is important to go back. We eat our vegetables, we eat our fruits in numbers than to have to eat the fast food that we are eating right now, because it's exposing us to breast cancer. Also, starting early to see your periods. When you start before the age of 12 years, because I've seen children 8 years, 9 years who are starting to see their periods. So when you start early, you are also at a high risk of developing breast cancer. And also when you start to see going for menopause after the age of 55, also at high risk of developing breast cancer. For my mummies, new mummies who don't like breastfeeding, it also increases the risk of developing breast cancer. So most of the time, let's make sure that as long as you have milk, because there are women you find that they don't have milk in their breast, so they can't breastfeed. Let there be a reason, a good reason for you not to breastfeed. But otherwise, make sure that you breastfeed your children, because you will be reducing the risk of developing breast cancer.
You've touched so many things that I want to just maybe follow up on. Can we go back to that self-screening? I know that I'm gonna put myself on the spot. Funny that I'm in a coffee shop and but I want us to do this right. I want us to do this right. I'm gonna try and demonstrate, and you're gonna guide me. Okay. I'm waking up in the morning and I want to screen myself. What do I do?
Okay, this is how I do it.
Yeah.
Then this is how I put my hands. Then
Okay.
this is how I move it. Starting from here, goes anti-clockwise. This is how I do it. You feel anything? Yes, you go around. You go around. This is how you check yourself. Then now you go to your nipple, you squeeze it and check if there is any discharge. That's how simple it is.
And you go to the next one and you do the same thing.
Yes, you do the same. And then you can even go to the under the armpit, and then you do this and you feel any lumps that are growing there. And then that's how simple it is to self-check yourself.
I've heard as well people complaining that sometimes you have to find the right time to do it. When is the best? Is it in the morning? Is it during the day? Is it in the evening? Must I not do it during my period because my breasts are obviously experiencing that time of my period? When is the right time to do it? Did I lose you there, Dr. Cruz?
Sorry, I got lost a bit. I'm back.
Okay. I was asking, is there a particular time that is best for me to do it during the day or during the time of the month? Because I know some people would say it's quite confusing, especially when you're on your period, to do the screening because already your breasts are going through that process, and they are it's either they are very what's the right word to use? I won't say
Tender.
tender.
Yeah, they are tender and very full sometimes when you go when you're during the period. So what will happen is that do it 2 weeks after your periods, just 2 weeks after your periods, then you can go around and check them. So it should be once a month, once every month after 2 weeks from your periods, then you can check them. Then as I've said it, that once you find that there's a mass, then you can go for what we call screening. Screening is important for every woman who's above the age of 40. All women should go for mammogram. If it's clear, then we'll go after 2 years for mammogram again. So that's how we do it for the people who are over the age of 40 years. And then for kids, 22 years old or 18 years old who find that they have a lump, then they will do ultrasound.
I want to also ask you, so once I find a lump, obviously, Dr. Dineo has explained that not every lump will result to cancer. So what would be the first step for me to now, go for whether I'm consulting a doctor, what do I do? What would be the first thing that I do practically now?
Yes,
Do I
once
go
you
to
find that there's once you find that there's an abnormalities that you find in your breast, whether it's that lump, small lump that you feel, then the first thing that you need to go is to visit your doctor, or you visit the local clinic. Then they will write you a referral letter to the hospital. As they will take the normal bloods, but the most thing is to do now either the mammogram if you are over the age of 40, or they will do the biopsy. Then that's when they're gonna say, if you are under the age of 40, then they will do what we call ultrasound to look what is it exactly. Then there will be more further tests now where they will take now the biopsy.
Oh, yeah, you're talking to lay people. What is mammogram? What is biopsy? Those are intimidation words and you've never seen
Okay. If breast, once you go to the doctors, biopsy one. Biopsy is when now we are cutting a little piece of that lump, and then we are taking it to what we call histology. Now it's going to tell us, is it cancer? At what stage it is? That's histology. But mammogram is that big machine that you put your breast on top of it, and then they press it, and then they look now. This is the lump, and what kind of lump is this? Is it malignant? Is it benign? The same as ultrasound, because ultrasound is done for those who are below the age of 20 or 40. I mean, then they will do ultrasound. We should be looking that this is the lump. What kind of lump is this? Does it need further biopsy, or what does it need? You see.
So I see a question there on the chat. When is the right time for women who went through hysterectomy to actually go to okay, let me read that again. When is the right time for women who went through the hysterectomy? I'm assuming the right time for them to go for screening.
I don't get the question. What is the right time to do what?
For women that have done, I'm assuming.
Hysterectomy, because I believe she says that they've removed the uterus. Now they
Yes.
cannot tell if they are on menstruation or not. It is
Yes.
important that as long as you are a woman and then you are over the age of 40, that once in a year you go for your mammogram. Once in a year you go for your mammogram. Your screening test will be important for you.
The question, Dr. Pro, is even if you don't see any symptoms, if you are 40, then go for the mammogram. Is that what you are?
Yes.
Okay.
Yes.
Thanks. All right. So it doesn't matter what procedures they have done in their body. If the age allows them, they need to go get that service from the hospital. Thank you so much for that. I hope that is answering the question. Can I bring you in, Thuli, because once the person who has felt a lump, now this includes both male and female, they felt a lump in their breast and they approach the doctors, then they get to hear whether this was cancer or not. But from your story, the results were different. They told you, the most devastating news anybody could hear. Would you please just bring us into your story and share your journey with breast cancer?
Greetings once more. Thank you, Mabongi, for giving me this opportunity. As I introduced myself, I'm Thuli Letsoalo again. Yes, I was okay. Firstly, I had a lump in 2021. 2021, I had a lump in my right breast. Then I went to the GP, as Dr. Prudence alluded. I went to the GP. They gave me a referral letter. Then I went to hospital. They did a biopsy. Then after a week or two, I got the results. The results that changed my life until today. The results that I got from the doctor, she said, Mrs. Letsoalo, you are diagnosed with breast cancer stage 3. And obviously that was not easy. That was not easy. As we all know, especially Black community, when they said you've got cancer, the only thing that comes to mind is I'm dying now. So yeah, it was tough. I got the results. It was in September the 14th, 2021. It was on a Thursday, and the time was 11:20 that I got the results that changed my life for good. Okay. And then the same year, 2021, in October, I went for operation. They removed the lump. Fast forward, 2022 in January, then I started with chemotherapy. Yo, it was not easy, guys. It was not easy. Cancer is not painful. What painful is the medication that heals cancer. Chemotherapy is so painful. Can I continue? Okay. As I was saying, chemotherapy is not cancer is not painful. What is painful is chemotherapy. Chemotherapy is very, very painful, guys. Before it heals you, it cripples you. To be honest, it cripples you before it heals you. So I started to do chemo in January 2022. January, February, March, April. I did chemo once a month times 4. Then in April, it was the 4th time. Then May, I started to do chemo every Monday, 12 times, meaning I'm talking about 3 months. It wasn't easy. And the most painful thing that, let me say, the most painful joke that happened to me, I cried for my hair over and above everything. I could see that I'm sick, but my hair, I was crying my hair. So yeah, my hair went off, inwele zonke, and lapho kumhlophe khona emzimbeni wami, lapho kumhlophe khona, it tend to be black. I'm not a yellow bone, but that time I was pitch black because of chemo, and the nails were black, and it crippled me. I used the crutches. I refused to use wheelchair because it was going to delay me. So I opted for the crutches. I couldn't walk anymore, and I couldn't feed myself. I couldn't bath myself. I couldn't eat anything. Like I would be being so craver for something that I want to eat now, and it must come now, and I won't eat that thing inside the house. I have to go outside and eat, and quickly before I vomit. I must be quick, do, 1, 2, 1, 2, then I'm done. So yeah, it went on and on. It was not an easy journey. It was not an easy journey. You can't explain. If somebody will ask me, how is chemo? I don't know, guys. I don't know. When I remember what chemo did to me, yeah, it was not an easy journey, but yeah, I managed to pull through the support of my family, my church members, friends, yeah. And one thing that I learned in this journey of having cancer is that um uh, each and every situation you need to learn to live right with people. Isimo nesimo sikufundisa ukuthi fanele uphile kahle nabantu, hayi uphile nabantu kodwa uphile kahle nabantu ukuze abantu bazoba nawe ngesikhathi on needy times. So yeah, i-support yabantu really, yeah, abantu i-support yabo came through ngesikhathi esi-right. They supported me. Medication only was not enough, but I needed people, and people were there for us. Then after 12 weeks of chemotherapy, I was down that time. I was down because I couldn't even wear the shoes. I was always wearing morning slippers. I couldn't even write. I couldn't even drive. I'm just learning now to write, to use a pen and to hold a pen. But I'm getting it right. So yeah, after 12 weeks, then I started the radiation. Can I have water, please? I started to have radiation. Then I remember, okay, radiation, I did it for 58 times. 58 times, excluding weekends. I was doing it during the week only. I remember one time while I was in hospital doing the radiation, I was going there every day for radiation. And in the process of me taking chemo, sometimes the situation would be bad. Then I will be admitted time and again in hospital. Then after that, on time for radiation, I got it 58 times. I remember one time I was in radiation, then those people who were busy with me, they forgot to they forgot about me. I think maybe they were busy with their stuff. Bakhohlwa ngami, ngasha ku-radiation. Then I got admitted again. Yeah, it was not an easy journey. After radiation, I got a depression. I went to psychiatric clinic, psychiatric hospital for 21 days. Then after that, because the person who was taking care of me is my husband, I don't have a mother, I don't have a mother-in-law, just my kids and my husband. Then after me having the depression, when I got discharged, my husband got a depression. He went to psychiatric hospital. So it was a very, very difficult journey. Indeed, it was very difficult. And as a result of me having lymph nodes under my armpit, I ended up having a big hand. My right hand is my right arm is very, very big. It's big to that extent that people, they even notice that why unless and sometimes I just laugh. I don't answer them because I don't want to go and explaining myself to everyone. So yeah, that's my journey. Thank you, Mabongi.
Um, and, I tend to be very emotional when I hear stories of pain and people's experiences, beyond being touched by your story. But I'm also just looking at the strength that you have to show during this time for your family, as a wife, as a mom, as a sister to someone, as an aunt to someone, as a friend to someone, as a neighbor, as a colleague. I'm looking at how each time we face someone who's going through such a hard time, it becomes such a burden for them, ukuthi bangasithusi, bangasikhombisi the intensity of their pain. So I can imagine some of the things that you have to, raise up just so that you don't fall apart. Perhaps the time you crashed, it was when you were trying to actually breathe after those processes. Thank you so much for being vulnerable with us and for sharing this process, because I think it's not for us to be tool, but it's for us to really know the depth of the disease, to understand the intensity of the whole process. But Dr. Dineo, can I bring you in? There are things Mrs. Thuli has mentioned in her journey of getting treatment. Would you then explain for us some of these processes from a doctor's view, and just explaining the process so that for anyone who hasn't gone through it will have a clear picture of what this chemo is, of what this radiation is.
Thanks so much, Mabongi. Thank you so much again, Thuli, for beautifully sharing that very heartfelt and emotional story. And really big ups to you for being a victor. We thank God. So I think she's touched on a lot of the treatment modalities that we use for breast cancer. So she mentioned the first one for her was chemotherapy. So this is basically when they use drugs. So firstly, they as Dr. Prue mentioned, first they have to assess how the extent of the cancer, how bad is it, how severe is it, has it spread to the other organs, etc. Is it involving lymph nodes in the armpit, etc., or not? And depending on those factors and characteristics, risk factors, etc., they then make a decision as to which treatment modality to take. So chemotherapy is basically where they use very potent drugs that are aimed and targeted at killing the very cancer cells. And unfortunately, as Sis Thuli said, they unfortunately, because they are very potent and they kill a lot of the functions of the cells, they unfortunately kill a lot of the other cells of the body, and so as she said, she lost her hair, and they get a lot of side effects. But unfortunately, that's one of the modalities that they have to use to initially sort of try and kill the cancer. And then they can go on to radiation therapy. So if you think of radiation, it's basically powerful rays. So an external machine that's going to impart then very powerful rays targeted at the cancer to try and kill those cancer cells using radiation. Okay. There is also the modality of resecting, so removing, in simple terms, basically the cancer. And removal can look like either them removing the entire breast, or they can do what is called a breast conserving treatment. So they then will try and resect the actual lump or the cancerous tissue and leave the breast intact. Or they can do what they call a sentinel lymph node biopsy or removal of the lymph node in the armpits. So if, for example, the cancer has only started affecting your lymph nodes in the armpits and hasn't spread to the actual breast, they can then decide to remove that lymph node. There are just various factors that they take into consideration: age, other things, whether your breast cancer is responsive to particular hormones. All of those things they take into consideration before they decide whether they can preserve the breast or not. And then there is also hormonal therapy, where they give you hormones targeted at then reducing or preventing that lump or the cancer growing if it's still in its very small stages and picked up early. So yeah, unfortunately, some of these treatments are very brutal. And actually, as Thuli said, that's actually quite the painful and hard part of surviving the cancer. Yeah, I don't know if I've missed anything that Dr. Prue can add on to.
I wanted to just, so does it count the age of the patient? Does it count also if the patient is male or female? The choice of the treatment and modality that they would choose.
Sorry, so your question is, does it matter whether they're male or female?
Yes.
Okay. Well, definitely.
The treatment is the same, whether this patient is male or female, or this patient is young and this patient is older.
No, it might vary. Look, we're gonna consider different things. A male who's got breast cancer, which is, I mean, very rare, but it happens. They're not so much concerned about the cosmetic appearance, you know what I mean? As opposed to a woman who's got two breasts, they're thinking, if you remove my one breast, what does that mean? How do I look? How do I wear clothes, etc. So those considerations. There's the consideration of age. The older you are, the riskier doing an invasive surgery is. So how can we mitigate or minimize risk, but also, is the cancer so severe that, so it's all of those things we need to take into consideration as to what's the pros versus the cons of doing an invasive surgery, what's the pros versus cons of you surviving this cancer. So it's a constant weighing of pros and cons and the risks that we put you at. What's the pros and cons of putting you on chemotherapy versus going straight into radiation therapy, etc., all of those things. So it's a constant weighing of what affects the patient most. Some patients can totally decline a certain type of treatment because, for any particular reasons, religious reasons, choice, etc. So it's taking into consideration what you think is best as the practitioner, but also how this affects the person.
So thank you so much, Dr. Dineo. This is hectic, hey? This treatment thing is hectic. Because it feels like, once people start this treatment, it feels like they get more sick than quickly recover. You know how you would have a headache, and once you take your tablet, that would subside. But it feels like before it actually treats cancer, it does take a toll on you. Can I bring you in, Dr. Prue, there? Because I want us to talk about that journey of healing. It's really touched on the fact that although, she was the one who was sick, but she needed people as support. there's a lot you write in your book about fortitude, the book about fortitude, and you're speaking to parents with, children with disabilities. I can imagine some of the fortitude that, the husband had to present during this time of treatment. Can you speak into how can patients and families manage that emotional or mental toll of treatment, and what are some of the practical supporting structures that could be put in place for anyone who has received this horrible diagnosis?
Okay. Yes, as we are talking about the diagnosis, Mrs. Mabung, once we start to bring the news to you that you have cancer, the patient, they will be shocked. They will have anger. They will have fear. They will have anxiety and depression. So there is psychological impact, which according to WHO, it says about 29% to 49%. There is psychological impact once a person is diagnosed with a breast cancer. So it is important as healthcare professionals, once we deliver those news, can we have a psychologist there and there and call all the family members around? Start with the family, counsel them, prepare them of what the patient is gonna go through. Then you call the patient. So a professional therapist is important. You call the patient now, you explain that no, because once you say you have breast cancer, I see death here. I am already preparing ibhokisi lami, umlandu wami, all those things, But once you tell me that no, it doesn't mean that. What does it mean? There are stages, there's treatment, this and this is happening. So it will be easy for patient to accept the condition. So let's start there as healthcare professionals. Call the counselors, call the psychologists, call the psychiatrists before we can start with the treatment. So we prepare the patient. What is also important is that as a patient, you need to connect and to talk with people who had a similar experience. I'm just happy that Thuli now has that energy, even if she's still cheerful and so on, but at least now she's there to tell other women her story, and of doing so, she will make other women outside there who are just diagnosed with breast cancer that no, if Thuli has made it, I can be also victorious. So to make sure that you connect with such women if you are going through breast cancer. I remember, by the way, Thuli, she's my primary school friend. She's my neighbor from Soshanguve. So we know each other very, very, very well. So even if I'm far, I'm in Nelspruit, but I was able to give that little support to her. So support is important. Support from the family. As I've said, that family, they cannot support if they are not yet psychologically being prepared. As she's saying that the husband suffered depression because during when she was assisting her, when he was there for Thuli, he had to suppress his own emotions, which later on now he had to go through depression. So it is important to take even children to go to the psychologist, prepare them, because the treatment itself is going to change the way she was living. It is going to change every time after chemotherapy. She's tired, she's in pain, she cannot cook anymore. She cannot do the wifey things. Sex will be dysfunctioning or not interested to do sex. This thing is a woman. And also changing the body, the structure of your body. As she said, that now her hand is swollen with lymphedema. The body structure, they lose the weight, severely lose the weight. And now if they have to go for a breast surgery, which is mastectomy, they remove one breast. Others, they are depressed by that now I don't look like a woman, because we identify women with what? With hair and breast. Now I've lost my hair, now I've lost my breast. You lose your identity, sort of. your feminine is lost there and it's taking you to depression. So when we look at the psychiatric disorders that they lead by breast cancer as a diagnosis and the treatment of it, it will be your severe stress disorder, it will be your adjustment disorder, and a major depressive disorder. So it is important to get that support, and including the community, including the work, your managers, they need to understand what you are going through and don't expect you to be the same as before. Because when you are going through chemo, there's this what we call chemo brain, where you lose your memory, you lose concentration. So you'll even at work, when after breast chemotherapy and radiation, you won't be the same again. So also you must embrace the new you. They must embrace the new routine at home, that no, I no longer cook since I'm from the chemo. No, I no longer do 1, 2, 3 because I get tired and so on. So people, they should understand and not force the person to be the normal or the old herself.
I think there is just so many instances that I can relate with in my own life. The journey of having family members battling with HIV, battling with TB, things that were very harsh. Even the treatment, the staying within the system, not defaulting on your treatment, things like that. I remember some of the discussions, family members saying, you know what, we're all gonna die. I might as well not take this treatment because either way I'm going to die, because it's not easy me. What are some of the battles that cancer patients have to face? Because sometimes they start treatment and there is no certainty about the treatment helping them per se. Doctors speak about there is this much chance that it would go forever and not come back, or you're completely healed. What are some of those things that you can touch on, that you can make us aware of, for us to look out for when we are, dealing with, I guess, family members that are going through this?
Even the Bible says, Mabongi, my people without knowledge, they shall perish. So if we have this, you see, I feel a pain that only 7 people are attending today, while there was supposed to be a number of people. This is educational. This is very informative. If people, they have attended this, it was going to give them that knowledge and understanding that even if I have somebody, my family member, who's going through chemotherapy now I'll be in her toes, understanding what she's going through after what Thuli told us. And you'll be now knowing how further can I support them. So it is important. Even at the workplace, I always encourage that if they should look at the what we call calendar wellness. Look at those things. If it's epileptic day, they have those events. Call the doctors to come and teach. They have the wellness in your company, wellness day, where we come as healthcare professionals and we teach about those things, whether they are sick people or they are not sick, but maybe they've left somebody at home who's suffering from anything like that. And then when they go back at home, they will be able to be supportive and they will know how to support that person. So let's have this engagement. Let's have like what we are having right now with you. I hope that many people, and I pray that many people, they can have that such organizations that they can teach about this, because teaching, it's all the one that is important. And that's where people, they can learn how to support one another, how to support the person who's suffering from the breast cancer. Even herself, she will find out, how can I be strong? As Noktula said it, that here she is. She went through chemo. She went through radiation. There are people who are scared of chemo right now. But once you see that there's somebody who's went through chemo and she has survived, then you'll be encouraged yourself that Monday I'm going for my appointment. So education is important. nothing beats education and knowledge.
So thank you so much, Dr. Pru. I concur. Sis Thuli, can I bring you in again? What are some of the things in just looking at hindsight in your journey with breast cancer that you wish you knew before you actually went through the experience? Or maybe you wish that people were aware of that perhaps you were neglecting?
Thank you, Mabongi. I think as a as a person who is sick, or as a support system, they must always filter what are they saying to the sick person. It doesn't matter which sickness, but as a support system, I think people, they need to think before they open their mouth. Sometimes as a person who is sick, you don't need lot of words, just you need a hug, only a hug, because the danger of words, sometimes our interpretation is not the same. Sometimes you will say a word, you heard somebody saying that word, you don't even know what does that mean, but because of you love that word, you're saying to another person, and the interpretation is different. Now already you are in, you made a mistake. I don't know if you understand what I'm saying. The thing is, people need filter. Sorry. What I'm trying to say, Mabongi, is people need to feel, the support system need to filter one, and as a challenged person, I need to team up with the people who are bringing out the best in me. Meaning, I need to team up with the positive people, not negative people. And because cancer, not sometimes, cancer, it has got that stage where they tell you not to go to the crowd anymore, not to go to church anymore. The only place you can go to is hospital and come back home. Hospital, come back home. There's a challenge in crowded environment. So it's very important, your circle. Yeah, I wanted that way. Your circle must be a good one. Your circle must be a good one. And even people who are checking up on you telephonically, you must select the the, 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 the crowd, or the people who are checking up on you, because of, your idle talkers. You know them, so it's very important to say, this one I'm not answering it. And then the other thing, the acceptance. From my side, I took time to accept my condition. Actually, I got a shock of over 2 year period. I was shocked. I started to accept the condition when my church, where I'm fellowshipping, they decided to throw a feast for me in the church. They decided to throw a feast to thank God that she's healed. That day I saw everybody in my church, a big church. Everybody was wearing pink and white that Sunday. I cried that God is me who is alive today. These people are celebrating me. That's when I started to accept and say, wow, oh, it seems then I need to to accept and move on with my life. So basically that's that. Now I'm in uh, medication for the next 4 years, because I think 1 year has passed now. It's a medication for 5 years. I think now I'm in my second year taking medication, and then every 6 months I'm going for the CT scan, the mammogram, yeah, all those things. So basically,
Thank you so much, Thuli. That is helpful. I think most of us feel the pressure to speak each time someone goes through something or tells us something that is, overwhelming. We are so afraid of silence. We're so afraid to say, I don't know how to respond to what you've just told me. I don't know what to do in this moment. Can I just sit still with you? We're afraid of those things because we feel like we need to fix something. Whereas, most of the time, we are not able to do that. And because we are only human. So thank you so much for that advice. It's truly. And also, I'm just realizing how the journey is so long that it cuts away through those illusions that perhaps if you would allow me to call out our faith community, that God is going to heal you. And then if it doesn't happen immediately, people tend to lose heart. People tend to say things that send wrong impressions. That is either there's something wrong that you have done as a person who is going through that tough time. And I really do appreciate how you have shared how your spiritual family came through. It is encouraging when people know that it's not their job to heal, it's God's job to heal. And they can only just be there to support while God is doing that. And so thank you so much for sharing that.
That's true. And the other thing that I forgot is to stand strong. Okay. Yeah, the other thing that I forgot to say is to stay strong stay strong in your faith. Because other people, they believe that when you have cancer, it's not cancer, they bewitched you. And if you are not you're not strong in what you believe, you'll be miserable. And yeah, my point here is stay strong, stand and stay strong in your faith. Thank you.
Thank you so much. Can I maybe allow for questions if anybody has a question? And also, if there are other things from my panelists, Dr. Prue and Dr. Dineo, if you would like to add as we draw this session to a close, if you would like to add anything that we may have missed in our conversation that is quite important for us to highlight, please, you can just go ahead and do that in this moment. The audience as well, if someone would like to say something, comment your thoughts, what was insightful to know in the session, then I'll give you a chance to do that.
There's really not much to say, as we have discussed and covered what is important. What I would like to emphasize is that as women, let's take care of ourselves, especially above the age of 40. Let's make sure that we do our mammogram after 2 years if it was found normal, and let's do our pap smear each and every year. Let's take care of our bodies by exercising and eating healthy. These are the main things that we need to do, especially over the age of 40, so that we avoid many sicknesses, diseases, and many cancerous are associated with wrong food. We all know what is wrong food. So let's please, if you don't know, please visit your dietitian, and so that you eat healthy, and you even teach your children to eat healthy, because cancer doesn't start late at 50s like it used to. Now, because of we are exposed to this wrong food, it's that early. It's that early. So let's go out there and change our behavior and do good for our bodies, knowing it's a temple of God. Thank you.
Thank you so much. Thank you so much for that, Dr. Prue. Dr. Dineo, is there anything from your side?
Not much either, but I just wanted to emphasize just the importance of support. I think honestly, even over and beyond the medical treatment and all those things, I think just knowing that you have a support structure, a scaffolding, people who will check in on you, people who will understand you, people who will just be there, not necessarily say anything, but just be there. I think is important. And so I think as people, we should all just nurture community, because you never know, and not with the intention for them to be there when we need them, but just because we just need community in life. And in the case that such things happen, yeah, I think that's all on my side. And then if there are any ladies who are based in Durban, I am doing a breast cancer prevention package, which is a clinical breast examination and a body composition scan, which literally just tells you about your body makeup and the health or ill health of that. Anyone can reach out to me if they're interested. Otherwise, that's all on my side. Thank you so much.
So thank you so much. I was just about to ask you, I know that there has been some campaigns that you've been doing on social media. You've been walking, you've been just to bring awareness, because I think that the key thing for us today is to bring awareness and to touch on key elements that whoever has then gotten the diagnosis, to know what to do, to know that this is not the end of the road. There is treatment, there is, support. So do you want to touch a little bit on that before we close? Dr. Dineo, are you still there? Are you able to let us know some of the campaigns that you've been doing during this month?
Sorry, Mabongi. I didn't get you there, the last part. Okay. Yes. So, I mean, look, there are a lot of places where people can get help. So, the governmental primary healthcare facilities, they definitely should be available to be doing some breast cancer screenings and health education this month. But also, I have been part of a sort of awareness with a non-profit organization called I Love Boobies. And they are an organization that basically is helping to raise funds through this virtual race for women in underserved populations. So your rural areas where women cannot necessarily afford to go and do mammograms, ultrasounds, clinical examinations, etc. For these women to get funded to do those things, or even for treatment. So if anyone is, looking for such funding or assistance or anything like that, they can look that organization up. I Love Boobies, boobies as in BOOBIES. They are online, on Google, on the socials as well. Yeah.
Boobies as in breast.
Yes.
Thank you so much. Thuli, do you have any closing remarks? Thank you so much.
Thank you, ladies, for inviting me. Thank you for trusting me to talk to your people, and I hope the information that I've shared is gonna assist one or two people out there. And I hope the information that I shared is gonna bring hope to the hopeless. And may God continue to bless you. May those patients that you are touching, may they be healed. And yeah, stay blessed and be blessed to be a blessing. Thank you so much. Dr. Prue Maimaki, thank you so much for trusting me. And everybody, take care of yourself, guys. Love you.
Thank you so, so much. We love you too, Thuli, and thank you for sharing your story with us and for opening up on the journey that you've gone through. You learned a lot. Thank you to my panelists. What I did get out of this session is just the knowledge of what breast cancer is, what are treatment modalities that are available. I also received the power of support that our families, friends, and everyone around us can bring in the instances where someone has to go through the journey of treatment, a journey of recovery. I also just have been very encouraged by the story of Thuli on her journey. It is indeed a bitter story. The elements that she touched on accessing the services from our health system, accessing all sorts of help, including psychological help as well. That was helpful to know. Because obviously when someone is sick, it's not just the physical that gets impacted, it's a holistic approach that we always aim for. So thank you so much for all of that. And for everyone who has taken time to be part of the session, thank you so much. And it is now our closing second. If we could all just react and send some love to our panelists. You can say hearts, you can say hands, you can say whatever that shows our gratitude as they have taken time to share their expertise with us. We've got some thank yous in the chat. Thank you so much for the wonderful session, sisters. Thank you for bringing the breast cancer awareness. God bless you all. I am available for motivation that's truly in your organizations or churches. Ladies, just give her a call. Her number is on the chat. If you could please, or maybe for the benefit who would actually watch the recording, it's 072-415-4495. And you can reach out to her on WhatsApp as well. Or you can give her a call and she can grace you at your event. But the idea is that we bring awareness because, as always, prevention is better than cure. Thank you so much, everybody, and enjoy the rest of your day. Bye.
Thank you.
Bye.
Bye.
Bye.